Hello, everyone. Thank you for joining today's webinar. Empower employees with a comprehensive benefits experience using personalized digital technology. This webinar is sponsored by Healthy. Healthy's AI-driven app redefines healthcare navigation, providing fast, accurate guidance on plans, providers, costs, and more. Healthy is committed to improving health outcomes and economic and organizational efficiency by minimizing confusion around benefits and coverage. Each week, Healthy saves HR leaders hours on employee assistance while reducing admin costs. It empowers brokers to deliver tailored experiences with personalized insurance recommendations. And Healthy enables finance executives to optimize healthcare investments through cutting-edge technology. I'm Sean Edwards from Validation Institute. I will be introducing our webinar today. Just a couple of quick announcements before we get started. Due to the number of attendees, participant lines are muted. However, if you'd like to submit a question for our speakers, please do so using the Ask a Question box that you see on your screen. We'll answer all questions that we have time to address during our session today. Also, please note that the webinar is being recorded and you will receive an email with a link to the video so that you can view it again. Now I'd like to introduce our first speaker for today. Guy Benjamin is the CEO and co-founder of Healthy. We are pleased to have him here. Guy, welcome. Without further ado, I'm going to turn things over to you.
Great. Thanks, everybody. Nice to be here. I'm Guy Benjamin. As you've heard, I'm a Healthy CEO. Just background on me. I'm originally from Israel, grew up there. First career was in the Israeli Air Force. You can see a picture of me right here. I used to fly F-16s, did that for about 13 years. Once I was done with that, I came here to the US about a decade ago, went to Yale, and then started working at McKinsey, the consulting firm. Did that for about 7 years here in New York. And while I was working at McKinsey, I've kind of realized that I have no clue about health benefits, about my own health benefits. And every time I have a question, I go to HR, they send me to a call center. Wasn't really the experience I was hoping to get. And at the same time, I've noticed that AI technology has really been improving and user expectations are changing. So I felt it was a good opportunity to kind of bring in AI technology to this whole world of HR and health and wellness benefits. So left McKinsey about 2 years ago, met with investors, kind of laid out the vision of how can AI help employees understand their benefits, raised about $26 million, and then started Healthy. I also have here today with me Julie Chapman, which is the U.S. Benefit Manager at Yotpo. Julie, do you want to just say a word about your role and what Yotpo is for people who don't know?
Sure. Nice to be with everyone today. Happy to be here, to tell you a bit more about Healthy from a user experience. We are a company that's about 1,000 people globally, but in the US, we have about 275 people. Our main headquarters is out of New York, but we have a remote office in Texas, as well as remote employees all over the country in about 15 different states. I myself am a fully remote employee from Illinois. And I oversee US benefits, for our entire team. So it's been quite interesting to have started with Yotpo 5 years ago in the office in New York and now be fully remote and to be supporting employees all over the country. And we have been partnering with Healthy since last fall.
Awesome. Thank you, Julie. So I think the best way to kind of start is just with a few survey questions just to get us warmed up. First question is, according to McKinsey, what % of people want to manage their healthcare journey digitally? Is it 30 to 40%? Is it 40 to 50%, 60 to 70, or 70 to 80%? We're starting to see some answers coming in. Give it a few more seconds. you can see here that basically most people think it's anywhere between 60 to 80%. I would say it's very close to being correct, because the right answer is about 70 to 80%. So 70 to 80% of people, according to this study, they want to manage their healthcare journeys digitally, meaning they want to look for providers online. They want to know what they're covered for online. They don't want to call anybody to kind of like figure it out. They really want a solution that's close to how they are used to using Amazon or Uber. And I think as we are seeing more and more millennials, Gen Zers becoming more prominent in the workforce, you'll see that number even increases even more. Next question. So according to Aon survey now, what percent of employees would use an app to access benefits information? Is it 40%, 52%, 63%, or 77%? So we have about half of people who responded. We'll give a few more seconds. Cool. So yeah, most of you are correct. It is 77%, which means that 77% of employees, they're looking for some kind of an app to access their benefit information. I think, as I gave as my example of when I had issues at McKinsey, we had an intranet, we had a call center. We didn't really have a one-stop shop kind of app or platform where I can see all of my benefits information. And that's something that we see more and more people are looking for. More and more employees are looking for that one-stop shop and not point solutions. And we'll talk more about that. Last question. It's more of a survey. What would you most like to achieve with a better benefit experience? Is it higher employee retention or attraction? Is it lower benefits cost, lower burden on HR, or have a higher benefit engagement? And this obviously there's no correct answer. It's more just to kind of like feel the room a bit and see what are we trying to achieve here. Yeah, we'll give a few more seconds. We're about half. Cool. Okay, so well, 1/5 are looking to improve employee retention and attract more employees. About a quarter of you are looking to lower benefit costs, which makes a lot of sense. Not many are looking to lower burden on HR. And then almost half are kind of looking to increase employee engagement or have higher benefits engagement, which is always a huge pain point with many of the HR leaders that I speak with. We're spending so much money on benefits, but we're seeing very, very low utilization. So it makes a lot of sense. So thank you for participating in the survey. We kind of like dive in a bit more now, but you guys know this. HR leaders are really relied on to kind of contain cost, answer employee questions, manage the benefit experience. The list just goes on. And I do many of these types of conversations and session and conferences and meet a ton of HR leaders. And they're all kind of like saying, there's so much that we need to do, but not many of them are really looking to kind of embrace technology to help them out. And I would say that the HR function is one of the functions where we're seeing the least technology being utilized. When you think about the CFO office, there's a lot of technology there. Sales have a lot of technology. HRs are still answering employees' questions by themselves. They're still managing benefits. But when you think about it, the technology is out there. And there is technology out there that can kind of knock out basically 20 birds with a single stone, which means not looking for those technologies that are just going to solve us one use case, but are ones that are really can provide a lot of value to us as HR leaders. And also it means that you need to prioritize because your time is limited. And are you going to spend time on answering employee questions, which you probably have to because they come up, or are you going to spend time on strategizing on what's the best retention strategy or attraction, right? And because you need to prioritize, it means that sometimes the strategic initiative sometimes put on hold and not really being spent enough time on. Now, what do challenges HR currently face? And I again speak a lot with HR leaders, and I can see a lot of gaps in this space. Right, there's a lot of challenges which we discussed, but we're also seeing kind of antiquated technology, especially if you're using a PEO or a TPA. I think we can all agree that most of those functions kind of bring in antiquated technology. We're seeing a lot of piecemeals experiences. So maybe a platform that only helps with one type of employees or one type of questions. But then at the end of the day, there's a lot of reliance on human support, which is expensive because it takes your time. It's also not a good employee experience. And it's not what our employees expect, right? When you think about we want to meet employees where they are, none of them is on their phone trying to call a call center. And if you guys are not looking at AI technology at the moment, I think this is a really good time to start thinking about it. Mostly because there's a lot of technology out there that exists. It's not just what we provide. There's many types of technology out there. But also I think we're seeing more and more HR leaders kind of like come in and look for the right technology. It also provides employee experience, much better employee experience, which you want to preserve, and you want to make sure that your employees are getting the experience that. Now, going into the kind of challenges, the first one, obviously, and we talked about it a bit in our survey, is rising care cost. And you can see this really interesting chart that talks about deductibles have more than doubled in the last decades. Family premiums have increased by 76% in the last decade, but worker wages and overall inflation has not really increased that much. So when you think about the burden and the cost that our employees feel, it's even higher than it used to be. So deductibles are higher, premiums are higher. This is one challenge that you guys probably deal with all the time because employees will come to you and kind of complain, but also we'll talk about what can they do, how can they reduce that cost if they can at all. But this is something that we talk a lot within different sessions with CFOs and HR leaders as well. The second thing is employee dissatisfaction. And you can see here, 45% see they're financially burdened by the cost of their employee insurance. 60% of them are confused because of cost. And then 63% of employees will consider leaving because their health insurance is too expensive. And again, this employee satisfaction, we know that there's a direct correlation between an employee experience with their healthcare and how they feel about it and their satisfaction with their workplace. And as HR leaders, I know that sometimes or many times employee satisfaction is one of our KPIs, one of our goals. And when you think about what their experience with their healthcare, it's sometimes not even, we can't even control it. It's not even part of it's what their experience from their insurance. But we know that it's a huge challenge that HR leaders are needing to deal with these days. Now, when you think about those two challenges, from what I'm seeing, and I'm sure that you can relate, employees, they want a better, less costly benefit experience. They want it to meet them where they are, which is digital, which is they're all looking for the Amazon experience, the Uber experience. And we know that based on studies, there's one study that was done by MetLife that says that employees that use digital benefit tools, they're more likely to feel satisfied with their benefits, not by changing your benefit, just by making it more accessible. They're more likely to understand their benefits. They're more likely to appreciate their employer's investment in their health. And we all need to ask ourselves, right? Like, are we providing that? Are we meeting our employees where they are? Are we meeting their expectations? Or are we still telling them, hey, come to me when you have a question, or call this call center when you want to figure out something about your healthcare? And if we are, that means that there's an opportunity, as I mentioned before, to kind of look into technology to kind of build a better employee experience. Now, when you think about the gaps in the employee benefit space, obviously there's many of them. I'll touch just a few, but the first one, and we kind of like alluded to it about it, is substandard apps, right? We know the provider apps are not great, and that's another statement. We know that a poor employee, like a poor mobile app experience, it's not better than nothing, because sometimes that's the only experience the employee will have. And when we provide them and tell them, hey, go to your provider or your carrier website, if it's not a good experience, they're not going to come back, and they're going to just feel like they don't have anywhere to go. So we know that that's a problem in the industry where most apps are just not on par to what employees are used to. The second one, and then we know that there's about $50 billion that healthcare industry is now worth. 80% of Americans use a smartphone daily for at least 3 hours. 25% of them only use a smartphone, not even a computer. And then we talked about it in our survey that almost 80% of employees want to use a benefit app to kind of access their benefit information. The second one, which I feel is like one of the most important one, is that piecemeal experience. Employees, they love apps, but they really don't like redundant apps. And they don't like the fact that sometimes an app will only cover one use case. So when you think about the platform or resources that we give our employees, we may give them a platform or an app for open enrollment to help them pick the best plan that they should pick. But that's one single use case. Or we may give them an app to see their HSA. Again, it's a single use case. And what happened is that our employees get lost with all these resources. We give them ZocDoc to book appointments, their carrier website to know their deductible, and then our intranet for any other benefits. And at the end of the day, they get an experience that they just drown within resources because of that piecemeal experience, because we don't provide kind of like a one-stop shop for all the things that they need. And when you think about, if you look at your phone today, on average, we have about 80 apps. But the number of apps that we actually interact with daily, there's about 9, so a little over 10% of them. And over 60% of our apps are not even used monthly, which is crazy. It just means that we have a bunch of stuff on our phone that is not really adding us any value. And as an employer, if we come in and provide more and more of these apps that are a single use case, they're just going to get lost in our sea of apps on our phone. And then the third one is kind of like generic answers, right? So employees, they want to personalize instant support for their care needs. The worst thing that we can provide our employees is kind of like a generalized information that is not really personalized to what they need, right? An employee may have mental health needs that is relevant to what they're experiencing right now, and generic answers will not help. We're not providing a personalized experience as our employees will look for, right? They're looking for personalized, instant, right at their fingertips. And calling a call center is never instant. It's also not personalized, and it's just not the experience that our employees are looking for. And again, back to these percentage, 70 to 80% of people who want to manage their healthcare journey digitally, we talked about it. 72% of people are actually looking up their benefit digitally, but sometimes they won't get the answer that they're looking for. And then 88% of employees really want to customize their benefits. They want to be able to customize it, and that's not something that is available today. And then when you think about it, failing to meet kind of employees where they are, it means lower employee satisfaction. It means lower retention. And it has a direct correlation with the satisfaction at their workplace. We need to rise to the occasion, meaning meeting employees where they are. I can tell you where they're not, right? And that's not going to be news, but they don't want to call. They don't want a point solution. They don't even want to come to HR and say, hey, I have mental health issues. Nobody wants. They want something that is instant, that is on their fingertips, in their phones. And that's kind of like what we're trying to build at Healthfeed, and I'll talk about it in a second. One more thing I want to talk about is what can we do to kind of like help employees with lowering their costs, help ourselves as employer lower our cost of healthcare. And we have 3 pillars here that are kind of like things to think about. And again, we'll talk about each one of this, but there's different solutions out there for different parts of this. But I like to think about 3 pillars. One is cost transparency, the other is steerage, and the third one is accessibility. And I'll go deeper into each one. The first one on cost transparency, obviously we have open enrollment. When employees pick a plan, they need to be very clear on how much that plan is going to cost, but also what's their expected cost. Not just how much I'm going to pay out of my paycheck, but what's my expected cost on healthcare for myself and my family throughout the year. What can I expect? What should I assume that's going to be my cost of healthcare? And that's something that we can do when an employee pick a plan. It just providing them the right tools. And there are digital tools out there that can help employees understand what cost they're looking at for every plan. 50% of employees will choose the wrong plan during open enrollment. The second one is, what is the cost in and out of network when I get a procedure done? Obviously, there's an issue in the U.S. where we don't even know the cost before we go, but sometimes we can figure out what is the cost if I go in network and what is the cost if I go out of network, and putting that side by side to employees so they understand the implications if I decide to go out of network. And that's something that also there's tool out there that we can use to kind of help educate employees. And then the third one is procedure cost. So what can I expect? What is the bill I can expect to get? And it sounds like it's, imaginary that you can know how much things are going to cost before you get it done. But I will tell you, there are tools out there, and ours included, where before you get an MRI, you can see that MRI will cost $200, the other MRI will cost $400, and if you go to a third location, it will cost $4,000. We are not smart consumers. Our employees are not smart consumers. Imagine going on Amazon and not seeing prices. That's what we do today when we pick our procedure location. We're not looking at cost. And there are ways to look at cost. There are ways to be a smarter buyer and smart shoppers when we go and get our procedures done. So again, there's digital tools there that can help our employees. So those are the things that we want to think about when we think about cost transparency. The second one is behavior steering. And that's more around how do we steer employees to lower cost, but still high value and high quality options. ER, 50% of ER visits are unnecessary. Every ER visit will cost the employee hundreds of dollars and the employer thousands of dollars. But 50% of the times, it's not necessary. We need to explain to employees that when there's an emergency, if it's not a life-threatening event, there's urgent care, there's telemedicine, there's other options other than the ER. And what I see a lot of times happen is that we'll do a session there in open enrollment. We kind of explain everything, but then ongoing throughout the year, there's not really a way for employees to kind of know how to educate and how to get educated on their option. And that's exactly what I'm seeing in a lot of places where it's just like one session there in open enrollment and that's it. The other thing is telemedicine. Not many employees even know that they have a telemedicine option. Some telemedicine will cost, could be some copay. Some of them are completely free, but we're seeing not enough usage with telemedicine because employees are just not aware that that's even an option. So that's something that we need to keep reminding employees that when they have an issue, if it's not something that you have to see a doctor in person and you can use telemedicine, it's usually much less expensive, much better. Also, you can find high quality, but still reminding them that exists means that you need to remind them a number of times throughout the year. So when they actually do need it, they remember to go there. And then the last one is more on in-network steering and explaining to employees the difference between in and out of network. We're still seeing 20% of claims today, like in the US, are out of network, which means that they're going to cost more to the employee and the employer. And then the third one is around accessibility. And this is kind of like a topic it's a bit soft, but it's something that is super important because I talk to a lot of CFOs or HR leaders that will say, we give our employees the best plan, the best benefits, but if we're not providing them ways to access those benefits, it doesn't mean anything. We need to have benefits that are simple to navigate, that are not making our employees go through hundreds of pages of plans design and PDFs. We need to make sure that it's understandable. It's not written in a language that is like, you need a lawyer to really understand it. And it needs to be convenient. And we talk a lot about how to make it convenient, make it sure that it's on your fingertips, in your phone, that it's more than just a one single use case. It's kind of like a one-stop shop. And when you think about those three pillars, we believe, and we're seeing that you can probably reduce your healthcare costs by anywhere between 5 to 15%. You can probably save your employees anywhere between $1,000 to $2,000 a year out of pocket. Some of our employees, that means another paycheck. And that's kind of like what the results that we're seeing. So I want to take a quick shift here and talk about what we do at Healthy. So what we build at Healthy is a one-stop shop, one platform that has everything an employee needs for their health and wellness benefits, meaning they can choose a plan during open enrollment and can get help on choosing the best plan they need. They know their deductibles, their ID cards are there. They can find doctors. They can know if they're covered for something. They can know how much things are going to cost. You can see on the left side how we kind of like show price transparency for each location, how much it's going to cost to the end user. And then we tailor all of it around our personal health assistant. Her name is Zoe. Imagine like a Siri or an Alexa, but for your health benefits. And the way Zoe works is that she can take any health plan, so medical, dental, vision, any point solution, any EAP, and convert using AI, convert those benefits, those long documents from an unstructured data source, which is just a nice way to say a PDF, to a structured and mapped database. And once that conversion happens, that's when Zoe becomes your personal health assistant, because you can go to Zoe and say, hey, Zoe, my daughter needs a speech therapist. And she'll tell you, first of all, if you're covered for it based on your specific plan. Remember, we talked about personalization. She'll tell you how much it's going to cost based on your deductible and based on how much each location will charge. And then she'll tell you where can you get it done based on your specific network, and then book you an appointment, all without talking to a single person, all on your phone, super convenient, and kind of like a one-stop shop. So employees can start the journey with picking their plan during open enrollment, continue it with understanding their benefits, understanding which doctors they can go see, and then actually booking appointments and seeing doctors, and even talking to doctors and therapists through telehealth, through Zoe at no cost. So, okay, I mentioned kind of like a one-stop shop where you really empower employees to make the best care choices possible, but you also streamline the benefit experience. You lower costs, you improve utilization, cut down waste and unnecessary spending. But that one-stop shop where you don't have to send employees to multiple call centers, intranet, it's all in one place. Your health benefits, your ancillary benefits, your doctors, your telehealth, everything in one place. Very reliant on AI. And if an employee wants, they can at any point talk to a live person. But we're seeing that 93% of our interactions are completely self-serve, completely instantaneous, and without a person in the loop, which is really cool. So I want to talk with Julie for a bit, who's been using Healthy for a while. And then maybe we can start with the first question, Julie, of if you can talk a bit about like kind of like the biggest challenges you faced as a benefit leader, like your challenges, your people's challenges. So yeah.
Well, we are a very lean HR team. I'm the only person on the benefits side. We have two other HR generalists supporting, about 275 people in the US, as well as our UK, Canada, and Australia geos. So that's the scope of the three of us. So anything we can do to help provide a better experience to our employees and also kind of decrease our workload is great. But the reason we really partnered with Healthy when we did is because we were in the midst of changing PEOs. And we were condensing, going from, I think, in the tri-state area, 14 different plans down to 4 nationwide plans. That was going to be a much better manageable amount for our employees. It would also be the same plans regardless of where our employees were in the US, which after COVID became a much more important thing to manage. And really, we wanted to make sure that we were educating our employees. We have a younger employee base. I have a lot of employees where this is their first job, or maybe their first job where they're coming off their parents' insurance. And basic questions: what is a deductible? I found myself spending so much time on just trying to educate our employees on what insurance is, how to use it, but alone how to be smart about using it. So we decided to partner with Healthy, when we were making that change from one PEO to the next. And it was about educating our employees, empowering them to make a good decision during open enrollment, and then just day to day, like how best to use these plans. We offer great plans. We have great low premiums for our employees. But the last thing we want is for someone to get stuck with an ER bill because they choose to go there instead of an urgent care or to use the telehealth. So it was not only to decrease our workload on the HR side, especially mine, but also give our employees a better experience and help them to understand what we were offering, because we do have such high class, best in class benefits that we offer them.
Yeah, makes sense. And it really connects with everything that we mentioned, right? Like employee experience is like something that we're very focused on. And it's great to hear that you're focused on it as well. Can you talk a bit about like what other solution you kind of consider before turning into kind of like AI technology, and, what made AI kind of seem like the best solution for you?
Yeah. So with the PEO, there was kind of their standard platform, but really our employees, like I said, they are younger. So everyone does things on their phone. No one wants to talk to someone. No one even wants to talk to me. So giving them that access at their fingertips, having it be an app that they can, access at night, or, we have flexible work hours. So we have some people that maybe are working well into the night, whether it's in office or at home. And we want them to be able to access their benefits when it works for them versus waiting for me to reply or waiting for the call center to answer their questions. And I think, everything we do, we're an e-com company. We're a marketing platform helping e-commerce brands reach their employees. So we know the importance of technology and that, great experience that our brands have with their customers. So we want to replicate that internally as well. We want to be on the forefront of things like AI, our internet, our people portal, everything, that we do is to try and streamline things and make it easy for our employees to get that information when they want it and how they want it versus kind of traditional ways of call centers or emailing me and waiting, for my reply.
Awesome, thank you. And what would you say like the biggest benefits you've seen from implementing AI?
I think it's just our employees having that access whenever they want. I've definitely seen a decrease in my workload. Part of it is I really kind of push people. I always ask them, even when they first reach out, like, hey, have you used Healthy? Like, here's a reminder of this great tool. In my new hire sessions, I always tell people, like, start there. If you still have questions, I'm always here as a resource. I always want to be accessible to our employees, but just reminding them of the tool. I've seen a significant decrease in, my workload throughout, this calendar year since we've gone live on these new plans, whether it was during open enrollment, which we had to run 2 times, both in November and then May of this year, and just day-to-day questions and new hire questions especially. I went from spending probably an hour with every employee when they would start, and we would usually have about 10 to 15 employees per month, to maybe talking to one of them outside of the new hire session. They know they have Healthy. They know they can kind of start there with their plan comparisons. So it's been great for me personally as an administrator to see kind of less of a workload, but have also heard feedback from our employees, which in benefits, you usually don't hear anything unless someone's complaining or needs help. So it's been great to hear from employees just proactively tell us, like, thank you for this. Like, I had a sick kid in the middle of the night and I was able to use the teledoc service, or, I was able to save money, or, hey, I didn't realize what an HSA was and what a high deductible health plan was, and I can take advantage of that and build up my savings in my HSA. So I feel like our employees in general, find the AI just to be helpful, to be accessible whenever they want it, and they just understand our plans better, which was our ultimate goal.
That's amazing. And we don't talk enough about kind of like the new onboarding of employees, right? Because that's also a whole different issue where employees come in from a whole different job and different benefits, and they need to understand, are they covered for this or not? And they may, every employee is a world of their own, and you don't know what benefit they had before that they really used, and they're probably not sure, do they have it now or not? And I think you're right. That's a whole kind of like pain point that we're not talking enough. We are doing something with it. Again, Healthy helps with that because a new employee can see all their benefits, but we're not talking about it enough. And it reminds me, we had another CHRO that we were talking with, and she was saying that her question from new employees, and she was getting a lot of new employees every month, kind of like diminished since she started using Healthy, which is really cool to see because it's also saved you time, but I think it also makes the onboarding experience much better. which we know kind of like how important that is, right? Like you only have one chance to make a first impression.
That's right.
Cool. Awesome. Thank you, Julie. So I think we have a few minutes. We'll open it up for questions. Sean, do you want to kind of see if there's any questions on the Q&A?
Sure. First question. My company previously had a health benefits app through our insurance provider that didn't help much. But I see the need for a more effective platform to address our gaps. How can I get a tech-skeptical employee population on board with trying another app? And Guy, I think probably you're the best person to ask, but Julie, I would imagine you have some insights there.
Say, it's always a question, right? Always people, we have customers are asking us, hey, yes, I'll get the millennials, Gen Zers to use it, but what about people that are a bit more skeptical? And I would say that when we designed the platform, we designed it that my 83-year-old mom can use it too. And if she can text, she can use Zoe, and that it's that easy. And I think it's on us, on Healthy, to kind of make sure that back to that first impression, you only have one chance, is to make sure that when an employee does use Zoe for the first time, they get such a wow moment out of it that they won't even think about going back to asking HR or calling a call center. And it's really something that we're very focused on, creating that wow effect. So even those skeptical individual, we just need to have them try it once. And we do that through webinars and training. We'll come on site. We'll do one-on-ones with employees if we need to really kind of show them how intuitive and how easy the use of Zoe is. It's as easy as texting a friend, right? You're texting Zoe and you're asking a question about your benefits. The difference is that Zoe is always available. She's instant and she knows your benefits. So I would say even the skeptical ones end up being believers because they just use it. And we have employees from all type of industries, right? We have restaurant workers, we have warehouse employees, we have tech employees, corporate, really everything.
Yeah, I would just add, I remember our Healthy rep, talked about a mailing that you guys could do for us. And again, it was very targeted, but we were able to think about, our employees that have spouses and partners at homes that may want to know about this app. I think, I know when I was on my husband's benefits, previous to Yapo, I had no idea what he had. I had no idea what was offered. So, sending a mailer home to make sure that the spouse or partner knew about Healthy, that there was something that could go up on the fridge where they could scan the app and have that on their phone. I think you guys do a really great job of reaching employees regardless of where they are in their life or regardless of how they really plan to use Healthy. And I think you're right. It's good for anyone at any age because it is as simple as sending a text.
Yeah.
And we have another question about language. The question being, what language is this available in?
Yeah, it's currently available in English and Spanish. And even we have benefit experts that are also available for a live chat, and they speak English and Spanish as well. Okay,
got it. Next question. Can you speak more to employee behavior steering? Guy, that would be for you.
Yeah, so, one of the most important things that we do is we steer employees to lower cost, high quality option. That means that the first thing that Zoe will do when an employee comes in, they'll say kind of like what they're looking for. They have back pains, they're thinking about having a baby. And the first thing we'll give them their options, but we'll give them their option in a way where we kind of like let them understand that what are the higher cost option versus the lower cost options. And for example, if an employee comes in and say, hey, I want to get an MRI, we'll first tell them if they're covered for it. We'll show them the different coverage in and out of network. So we'll kind of like steer them already toward in network. And then when they look for an MRI in our platform, we'll actually show them each location, how much they charge. And they can play with distance or cost or quality, but you can see that once you show someone cost, they'll go to a high quality, lower cost option just by, basic human nature, right? Nobody wants to go and pay $2,000 for an MRI where you can get one for $200 for the same quality. And then at the end of the day, an MRI is an MRI. We also do a lot of steerage towards telehealth. So every time an employee asks a question that telehealth is relevant, that will be the first option that shows up. That means we can steer them again to telehealth, which is on our platform, it's completely free. There's not even a claim behind it. And there's no cost to the employee. So you really can steer employees to those lower cost options. And then we also nudge employees. So we'll nudge them to get a yearly physical or mammogram for women over 40, or skin screening before the summer. So those kind of like nudges as well. They're also steer employees to get more preventive care checkups.
Got it. Next question is for you, Julie. My employees are barely engaged with their benefits. How has technology helped you raise employee engagement?
I think we've seen a huge uptick both in our utilization of Healthy. Our Healthy rep can share quarterly stats with us about kind of how many people are using it, how many people are especially using the teledoc or telehealth service that we have integrated. But we've definitely seen more people utilizing, and navigating their benefits through Healthy. And I definitely hear from employees more with positive feedback that, they feel much more educated about their plans. When we switched carriers and we changed plans, I think there's that initial sense of nervousness about like, well, are these plans going to be good? I have this existing prescription. Is it still going to be covered? So people were able to kind of choose the plan that best fit them with that personalized experience. And day to day, they're just making smarter choices, which is great for us as an employer, especially as we look to move off of PEO, which we have scheduled to do in 2025. Hopefully our employees will just be smarter users. So when we're kind of out of the safety net of the PEO, we'll be able to really kind of keep down those employer costs. But overall, our employees have been very happy. We've seen great utilization rates, great usage. Like Guy was just talking about, like the steerage towards, telehealth options versus even going to urgent care or waiting for that primary care appointment. So we've been really happy, with how our employees have engaged with it. And just having that, accessibility day or night, whether it's the middle of the night, getting connected to the telehealth service or, being able to get a question answered about coverage at 9 p.m. when I'm offline and, I'm not going to answer your email until the next day. So our employees have been really happy. And as an administrator, I've been very happy with the usage and the utilization and how people have adopted Healthy.
Got it. Thank you. Guy, you're the best person to answer this next question. Does the platform also connect to vendor websites and facilitate single sign-on so the employee can use Healthy as the nexus for accessing all coverage types, or is it more informational and it consolidates the informational aspects of certain plans like SBCs or benefit summaries and related compliance and governance questions regarding eligibility, participation, QLEs, et cetera?
Yeah, so it's a good question. So the short answer is yes, we do single sign-on with other vendors, but I will say even more than that, we don't just provide information on the SPD, we provide you information that is based on your eligibility. So we'll tell you where you are on your deductible. We'll tell you where you are on your out-of-pocket. We'll tell you what will be the cost based on where you are on your out-of-pocket, right? So have you met your deductibles or not? We'll show you your ID card from your carrier. And then, yes, if you have other vendors, we can create single sign-on. So when you go to Zoe, that's kind of like your one-stop shop. And you can go and navigate to every one of your other vendors, but you don't need to kind of log in again and again every time. So yes.
Got it. And what about pricing and the size of employers that you typically work with? Could you talk about what you charge and some of the employees you work with?
Yeah. So we work with any size of employers. We have employers with 20, 30 employees, and we have employers with 100,000 employees, and everything in between, honestly. Our cost is really based on the size of the employer. Our kind of like first cost is about $6 per employee per month, and that's including the employee and their family members. But then that goes down a bit as we get to thousands and thousands of lives.
Okay, got it. And Julie, this question's for you. My employees are barely engaged with their benefits. How has technology helped you raise employee engagement?
Well, I think I might have touched on it before, but, I think our employees have definitely adopted Healthy as kind of their go-to, first stop in terms of their questions, navigating, understanding their healthcare. So we've definitely seen people, start with Healthy in terms of their questions, usually be able to just find their answers or be directed to telehealth versus coming to me. But overall, I think our employees are really, happy with having that technology and that accessibility when it works for them versus, waiting to get on the phone with someone or waiting to hear back from me.
Okay. And Guy, question for you. How much, in terms of benefits personalization, how much can employees get with the help of AI?
Yeah, I think here people are sometimes will underestimate how much personalization you can get. It's pretty astounding how much personalized the platform can be. Because when we come to an employer, we don't just provide the platform as is. We'll build it to their needs. We'll build it based on what other benefits they have, what ancillary benefits they have, what type of plans do they provide, networks. And then when it comes to the employee level, it will be hyper personalized based on their eligibility. So if somebody doesn't have dental coverage, they won't see dental benefits. Or if they are not a woman over 40, they won't get a recommendation to go get a mammogram. So it's really hyper personalized. And sometimes people think that AI is just kind of like a off the shelf, kind of it is what it is. Our specialties is to make sure that the platform is personalized and customized to the employer needs.
Okay. And this next question really is for both of you, and you both touched on it periodically throughout the presentation, but this speaks to older employee population. So I have an older employee population. Have you found that mobile benefits apps resonate with that demographic?
Yeah, I would say that as I mentioned, we're seeing different type of demographics using our platform. And by the way, for different needs. So, when you say kind of like older, they still know how to use a smartphone. We saw that 80% of Americans use a smartphone for at least 3 hours every day. So when you want to look for a provider, for example, if you can do it on your phone, I would argue that it doesn't really matter what age you are. If you know how to use a phone, you'll prefer to use it on your phone than call somebody and wait, sometimes 45 minutes to an hour on the phone. Or if you have a question that is a bit more personal, like mental health or weight management or things that you may not want to share with anyone else, if you have an option to go and do it by yourself that is instant, you'll do it. So I would say that it resonates with demographics that are, because it's not like we're giving them a tool that they've never used before. If they use Amazon, they can use Healthy. If they use their phone, they can use Healthy. It's that easy. Julie, what do you think?
Yeah, I mean, like I said, our employee population is, definitely younger, but I think that accessibility and to be able to use it how you want it, when you want it is great. And again, it's just the platform is so intuitive. We were, as administrators, I was very happy that we were able to customize, things on Healthy in terms of open enrollment, to make it kind of match what we were giving to employees and other info sessions or trainings or webinars. So it really felt like an extension of what they would hear from me. And it just, I think the ease of use is great. And like Guy said, if you can text, you can use this. It's really just asking questions and getting those personalized answers, to your plan, where you are, and kind of what you're looking for.
Okay. And another question, do organizations currently use wellness and or financial well-being along with Healthy?
Yeah. So what's cool about Healthy is that because we're that one-stop shop, we can take any additional benefits or well-being benefits, financial benefits, and kind of put it in the platform. So we even help with increasing usage of those benefits, because now people will just come to Zoe and she'll remind them that they have those benefits. So yeah, we have employers that will use their additional wellness benefits and financial well-being within Zoe. So it's definitely something that we're seeing with a number of our customers.
Okay, great. And Guy and Julie, any final takeaways or words of wisdom you'd like to impart on our audience?
Julie?
Yeah, I'm happy to chime in as a user. I think the one thing that I really enjoyed as a partner with Healthy is how flexible they are with kind of getting information to our employees. I touched on it just a moment ago, but really being able to customize, whether it was the open enrollment portal to kind of match, presentation materials that I'd be sharing internally, ideas, could we try this? Could we highlight this? I really appreciate that they really do partner, and I'm able to get usage stats. I'm able to kind of highlight certain things. We've got fall nipping at our heels despite the hot summer weather still, but we'll be rolling out flu clinics, and to be able to highlight that on Healthy and to be able to tell people, hey, we're going to offer this in office, or if you're not in New York, here's how you can find a place to get a flu shot near you. It's just really great to be able to partner with them and always kind of have ongoing conversations, and really make sure that the portal is working for us as a user and for our employees. So I appreciate their dedication and their flexibility all the time.
Awesome. And I'll just add that, kind of like final thoughts on my end, our vision is really to create a world where people understand their healthcare options, they take advantage of it. And that's kind of like, that helps us with fulfilling our mission of making employees healthier and reducing the burden of healthcare costs to both employees and employers. And I want to thank, first of all, everybody who participated for this opportunity, but mostly also to Julie, who kind of joined us out of her very busy day and has been an amazing partner for Healthy. So thank you, Julie, and thank you for everybody for being here. If anybody wants to get in touch, you can feel free to either reach out to me. I'm at guy@healthy.co. Healthy is spelled with 2 E's. And find us on LinkedIn and all the other social medias.
All right. Well, thank you both for participating in a great webinar today. Thank you to Healthy for sponsoring and making the session possible. Just a reminder, everyone, also that the webinar has been recorded and you will receive an email with a link to the video so that you can view it again. Thanks again for joining us, everyone. Have a great day. And this concludes today's discussion.
Thank you.